my job. I provide veterinary care for the collection. What does that mean? I do preventative medicine. Just like you go to your doctor, you have your blood checked, you have your heart checked, all of that stuff. You might get vaccines if you're a child. If you have a sore throat, you go to your doctor and he gives you antibiotics, something like that. So I do that here, only I can't get my patients to come and, you go to the doctor and you sit on the table and your dog says, hey, how you doing? What's going on in your life? Where does, oh, my left knee hurts. Well, let me take a look at your knee and hold still. Can you breathe in and out while I listen to your chest? You can cooperate. You do what your doctor tells you. You have a conversation. Well, I can ask one of those chimps to come sit on my exam table, but it's not going to cooperate. When I put the stethoscope on his chest, he's going to tear the room apart. So we have some barriers to get through to be able to do basic preventative medicine. Even if you're taking your dog or your cat to the vet, the veterinarian, and I know because I do this, you can sit down on the ground and pat the dog and talk to the owner what's going on, and you can feel the dog's legs. You put your stethoscope on and have a listen to the dog. Dog's awake the whole time, maybe a little bit nervous because you smell like a vet. I kind of want to bite you. But you can do a lot with a dog or a cat or a horse just walking up to it. I can't do that with a tiger. I can't do that with a lion. Even the friendly ones. Even the friendly ones. I told the last group we had a tiger here when I first got here whose name was Drifter. Some of you guys might remember Drifter. And I loved him. And he loved me, and I would go up and he would moo at me and he would chuff at me and I would feel so special. And I had this thing for Drifter. I went to see him every day. Well, I went in there one day to vaccinate them with the blowpipe, and he was like a nuclear tiger. He was a completely different animal. Ears back, teeth bared, this horrible rumbling noise, and he's down like this, and I was like, oh my God, So he knew, just seeing the pipe, that something bad was gonna happen. So there was no way I was gonna get near his cage. The nicest, sweetest, friendliest, cuddliest lion or tiger, the minute we lose respect for who they are, we're losing respect for them. I can't forget who they are. Have respect for their abilities, respect for what they really are. So even preventative medicine has some challenges to it, which we get past with anesthesia. We're going to get into that. I also do emergencies. We do have emergencies here. We have firestorms, we have floods, we have animals fall, sometimes they get in fights with each other. So there's always something that comes up. It's not just routine health checks. And then there's chronic illness. So like I said, a lot of our residents came from less than ideal backgrounds. They were inbred. They were backyard bred. They were illegal pet trade. They have ongoing chronic issues. And also many of them are geriatric. So because they have access to veterinary care, because there's no pressure of predation or natural selection in the wild, and because they have good husbandry and diet, they live a long time. So, like, that's the last group. How long does a lion live in the wild? Does anybody know?
7, 8 years.
Yeah, 7, 8 years. So I got lions out here, lots of them in their 20s. So we have a 27-year-old hyena out there. That's 2.5 times natural lifespan. We keep these guys a long time. So we're dealing with a whole set of problems that you have no wild control for. Leopards with arthritis, and hyenas with dental disease, and wolves and heart failure, and cancer, and all these age-related problems that people are like, well, what are you going to do with what does a leopard in the wild do when it gets lymphoma? Well, it's dead before it has a chance to get lymphoma. So we have a lot of extrapolating that we have to do from domestic animal medicine and from human medicine about how to manage these age-related changes in captive managed populations. And that can be for decades, right? If I have a cat come in here and it's 3 years old, we have a tiger that came in this year who's 2.5, and he's going to live until he's 18, 19, 20, 22. That's a long commitment to him as an individual. The chimpanzees live 50, 60 years. So this is a generational commitment. And it's a lifetime of health care for them too. If they have an ongoing problem, it's something that we have to manage at every stage of their life. So sometimes veterinary care means things like, well, how do I modify the enclosure so the animal that now has arthritis from the cervical compression in its neck How do I change her enclosure so she can still do the things that she wants to do, keep her emotional and mental health in a good place, and not have to worry about her falling or not being able to get up to her favorite perch. So sometimes the veterinary staff is out there modifying enclosures as well. That's part of their care. That's part of their emotional and mental health, which is part of their physical health. Stress plays a huge role in captive populations. They hide their illness, they hide their stress. They're all living with some degree of cortisol being released because they're in captivity, right? And that can affect their immune function, their appetite, their ability to fight off other diseases. So anything that we can do to keep them happy, minimize the stress function, is going to make their lives better. And if they're in captivity for 20 years, that's a huge part of my job. How do I keep her happy? It sounds simple, but that's part of medicine. National Zoo, they have staff, veterinary nutritionists. Or you'd have a curatorial staff that manages the nutrition. And the vets sort of provide broad overviews of what it should be. But we're a nonprofit, we wear lots of hats. So Silvio and I do the nutrition for the animals as well. And for me, I think that makes me a stronger veterinarian because I can tailor the animal's diet to their specific needs. We can add supplements. We can change the amount of omega fatty acids that they're getting. We have a lot of skin issues here. We are in a high desert environment, right? And we have a lot of animals here that come from subtropical and tropical environments. So their skin is really poorly adapted to life in Southern California. So a lot of my nutritional management goes to how do I keep their omega fatty acids up? What kind of foods can I offer them that will support their derm function? And I have a great dermatologist who comes up here. She calls it her field trips. And she brings her residents. And she goes through the compound with me, and we look at this animal and that animal, and if we have somebody who's having a problem, we'll anesthetize the animal so she can actually do a derm workup on it. So nutrition plays a big role in how we manage them non-invasively. We also do a lot of enrichment management in the veterinary program. So enrichment is their behavioral, emotional, and psychological management. And some of you guys are volunteers that do enrichment here. And all the animals get enrichment. So if you come on a tour and you walk through the compound, you'll see boxes and toilet paper rolls and weird objects, and you're like, what's all this junk in the cage? Well, it's stuff for them to do. And it's to stimulate natural behavior, foraging behavior, pro-social behavior among the primates, natural feeding behaviors. It's analogous to if you're stuck in a closet giving you a book to read or a picture to paint. So instead of just feeding them, it's giving them food for their brains. And it helps them minimize their stress, and it helps them behaviorally interact with one another, interact with their caregivers, with us. So enrichment is a huge part of what we do. Try and make sure that it's not just food. Everybody wants to feed the animal, but there's a lot of toys that we can give them, games that we can play with them. Some of the enrichment teams will come out and they'll put up bubble makers outside the wolves' enclosures, and the wolves will go back and forth chasing the bubbles as they go along. They play music for them. They play sounds that they've recorded from other animals. When we shear the llamas and the sheep, we have enrichment teams that will take the fur, the wool, from those animals and use it to enrich some of the large carnivores. And the carnivores love it. Oh, it's the smell. Can I eat it? Where is it? You know? So there's a whole bunch of these little pieces that fall under the veterinary umbrella. We do quarantine. So any animal that comes in here has to go through a quarantine period. And that's to protect our collection because they're coming from who knows where. I don't know if they've been vaccinated. I don't know what's going on with them. So they go through quarantine. At the end of their quarantine period, they get a full exam, and often on exam, we find things that I need to do for that animal. So it gives me a baseline. Oh, look, this animal's perfectly healthy. That doesn't happen too much. We have a mountain lion. I'm going to talk about this mountain lion some because he's a cool case. He came in fairly recently, and when we did his initial quarantine exam, we did it when we went to rescue him from his facility. We had to anesthetize the animal for transport to get him in a crate. And he had a draining tract on his chin. He had pus coming out of a hole in his chin. So we took our fancy x-ray machine, which I'll show you, that travels with us. It's lightweight, portable, battery operated, super wonderful. And we x-rayed his head, and he had an abscess around the base of one of his big canine teeth in his jaw. And I sent those images to a veterinary dentist because if left untreated, that abscess was going into the bone, and eventually it would have weakened the bone of his jaw right here, and he would have fractured his jaw. So on our quarantine exam, we found this, and the dentist came out several weeks later and did an extraction of that tooth and cleaned the bone up, and we treated the animal. We also found during his quarantine exam that he has a heart problem. So he's 12, so he's past his natural lifespan, but he could live well into his 20s. So I had a veterinary cardiologist come out. I noticed during exam, I'm kind of a knucklehead, I'm a generalist, I'm not an expert at anything, but I know when something's wrong. So I'm listening to this animal's heart, and it's going bum, 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 bum. I'm like, that's not right. I don't know a lot, but I know that's not right. So, and it persisted. It wasn't just the drugs. So that's the other thing. I'm giving him a lot of drugs, and the drugs change his cardiac function, right? So I'm like, is this something that's from the anesthesia? And I reversed some of the drugs that I thought were messing with his heart, took those drugs out of the picture, brought him up a little bit in his anesthesia. His heart's still doing funky stuff. His heart was doing such funky stuff that you could see it outside his chest wall doing this kind of thing. Like it looked like he was double breathing. So I called a cardiologist. And this is a big part of what I do, is build a network to support the animals here. So, like I said, I'm a generalist. I'm good at the foundational building blocks with medicine, but I'm not a dermatologist. I'm not a cardiologist. I'm not an ophthalmologist. The cool thing is, if I call one of those people and I say, I have a mountain lion, will you come and look at him? Oh, and please don't charge me. They always say yes. Always. I've never had anyone say no. Because it's an opportunity for them to work on an animal that they would never get their hands on otherwise. It's an opportunity for them to do practice building. It's an opportunity for them to bring their students or their residents and learn something new. And it's an opportunity for them to use their skills and expertise to give back in some way. So it's a win-win for them. It's a win-win for us. We get the benefit of their skill and expertise. And I get to learn something too. So my philosophy in the health center is to fill the room with people who are smarter and more talented than myself and step back and let them do their job. And the animals benefit, and I learn something in the process. All the kids say that. How do you know how to take care of a fish? So, and I have. I've taken care of lots of weird animals like piranha. I said this the last time. Piranha, poison dart frog, California condor, Komodo dragon, and white rhino. Like, you name it, we're supposed to be able to do it. Is there anybody who knows all there is to know about all those animals? Yeah, no. I don't. There's too much to know. That's what makes it interesting. You're always learning something. I'm a student every day. But the process that we go through is the same, the diagnostic process, and it's a process of detective work, really. It's when you go to your doctor's office and you sit down on the table and they start talking to you, they're taking your history. That's step number one. So you can tell them your history, the animal can't, right? So you have to observe the animal, you have to ask the keeper questions, you have to read the history and the record. Where did this animal come from? Was it backyard bred? Is it somebody's mangled tiger from a drug dealer? Was it bred in a laboratory? How many of its physical manifestations are from its previous issues, previous history, husbandry? Most of the reptiles that come in here had poor husbandry, and they have metabolic changes in their bone. So if I see a lame reptile here, one of the first things that I think of is I need to look at its bone density, because it probably wasn't given the proper calcium before it got here. So you start with your history, and then you have to get all your physical findings. That's where the fun stuff comes in. So we can't walk up to our patients. Well, we can. We can walk up to them, but they might hurt us. They might eat us, they might maul us, they might mangle us. And like I said about Drifter, even the sweetest, nicest animal, if you approach them with a dart gun, once they've been darted once, the second time, it's going to be a different experience, And they are very forgiving. They're very forgiving. And they do often know when you're trying to help them. But in order to work on them, I need to anesthetize them. So here's my little veterinary lecture. When you're watching TV, and the guy's got his rifle, and he's Chris Pratt, right, with his hat, and his, cut off, whatever shirt, safari shirt, and he's like, I'm going to trank the animal. It's not tranquilizing the animal. tranquilization or sedation is when you reduce the stimulus, right? So the animal is still awake, it can still feel pain, and it can still react to you. It may not be bouncing around like this, it's sedated, but it's still awake, okay? Anesthesia is when it's out. Anesthesia is when I can work on it.